Hello everyone, Dr. Liello and I here, answering all of your coronavirus questions. Now the last time I checked, in Canada the numbers were up 14% and in Quebec about 25%. So we hope all of you are well.
So for some of you who don't know, we've been answering questions submitted on various social media platforms. So we have our email address, which is info@cardiogenix.ca. We've been getting comments on Instagram, Facebook, YouTube. So please continue to send them in. So we'll get started with the first question, why don't we? So here it is. I'm likely at a higher risk for complications with the coronavirus because of my asthma and high blood pressure. However, with my blood pressure controlled by medication and regular cardiovascular workouts, does this lower my risk for complications at all? So right now, in the middle of the pandemic, unfortunately, we don't have enough information to really say one thing or the other. What I could say is, if we theorize, technically your blood pressure, if you had high blood pressure that was poorly controlled, in all likelihood, you'd be at a higher risk than someone with high blood pressure that is well controlled with medication. Now, I would suggest that someone who is diagnosed with high blood pressure, even though their blood pressure is well controlled with physical activity and medication, they may be at a slightly higher risk compared to someone who is never diagnosed with high blood pressure. But that being said, I think we should really highlight the importance of the cardiovascular activity that you've been doing. So especially kind of mid-pandemic, we know that cardiovascular activity helps release endorphins. So this is great with all the stressful news that we've been getting, for your mental health. Secondly, we know that regular physical activity helps to boost our immune system, so this helps. And finally, of course, we've been telling everyone to do regular cardiovascular activity because we know it reduces your risk for heart attack or stroke. So still very, very important to do.
Yeah, some great points over there. Great question. I have one over here. This is a popular one. I've seen a lot of reports that people are sharing on social media platforms that Advil, otherwise known as ibuprofen, has negative effects on COVID-19. Is there any truth to this? Okay, very interesting question. Let's start like this. If we're talking about coronavirus symptoms, so assuming you have coronavirus, let's say you have the fever, let's say you have some muscle aches, let's say you have some pains, my first choice would be Tylenol or acetaminophen. I think everybody's in agreement that that's the safest thing from a side effect profile, and that would probably be our first choice. But we know there's a little bit of controversy in this area because the World Health Organization flip-flopped on this and changed their mind, and that created some of the confusion. But what we could say at this moment, the position for most of the world experts is that there is no negative impact that we see with respect to Advil, ibuprofen, the anti-inflammatories, and the coronavirus. Yes, start with Tylenol if you can, but if you need the Advil, I don't see any adverse effects. Now, especially we want to emphasize that some of our patients are chronically on anti-inflammatories. This could be for a special arthritis, or it could be from their underlying disease. When it flares, they may need some anti-inflammatories. And there is absolutely no reason not to take that. So we would say continue your regular anti-inflammatories. Take them if you have a flare. If you have a choice, start with the Tylenol. And I think that's the best information we have.
Perfect. And in general, the main recommendation that we make when it comes to people taking Advil, you always want to be careful. If you have high blood pressure, if you have asthma, if you have any history of bleeding, all of that stays the same regardless of the coronavirus.
Good point.
Yeah. So another question I have, how could we be assured that after this 3-week lockdown period has expired, we'll once again be able to socialize with friends and family? Will the virus disappear after this period, or will we still have to practice social distances? So this is a great question. Everyone's been asking this. And in fact, even after this 3-week lockdown period, we're still going to have to continue practicing social distancing. I think this is something that we're going to have to carry forward with us for a very long time. The only time we're really going to know if it's safe or not to go back to our usual life is if we continue testing everyone. So testing people who have symptoms, who don't have symptoms, people who came back positive to know if they're now negative or if they're immune to it. We just have to test, as we've been saying. And that's the only way we're going to understand how many people are protected. You know, we brought up a concept in our last video about herd immunity, and this is the same thing. So we're either going to know that people come back negative and are protected, or we're going to have a vaccine and we're going to be able to protect everyone with it. So that's really the only time we're going to know it's absolutely safe. But great question.
That's a great point, and that's why South Korea is really a global leader in this sense. Their mantra is trace, test, treat. So trace all the contacts,
Exactly.
Test everyone, maybe retest them also, and treat. The treatment is isolation at the moment, and I fear we may be a little bit behind in Quebec. I have one over here. Could you explain what is meant by not touch your face? Could the virus enter the pores of your skin? So we're always talking about not touching your face. So I'm sure a lot of people have this question. So there's two parts to this question. One is, yes, the virus can live on contaminated surfaces for hours to days. And if you rub your eye, touch your nose, touch your mouth, there's a potential that it enters through one of those openings. Now, having said that, as we learn, as the pandemic evolves, we think that is important. That's why you need to keep washing your hands, keep your hands away from your face. But it may not be the primary mode of transmission. The primary mode of transmission, we believe more and more, is droplet transmission within 6 feet. So that's where that 6 foot radius comes in. But we need to do both to protect ourselves. The thing about the skin, no, there's no evidence that it's going to go through the pores of the skin, or even if there's a break in the skin. Take care of your skin as you normally do, hydrate it, take care of any wounds or abrasions that you may have, but that's not going to be a portal of entry.
Right. So if you do have the virus on your hands and decide to scratch the back of your head, it's unlikely that that'll transmit the virus.
Good point, yeah.
Another question I have, so for the next few weeks to come, is it best to go away to our country place? It's not far from a hospital, and isolate ourselves this way. If we ask our 2 boys to come with us, should they be quarantined before we allow them to stay with us? So in general, this sounds like a pretty good idea. Of course, even at the country place, you're gonna have to take all the same precautions in terms of hand washing, social distancing, cleaning surfaces. So the same as you would elsewhere at home. And you bring up a good point with your boys, because we're starting to see that a lot more cases are people who are asymptomatic. So they may not present with symptoms, and we wouldn't know if they have the virus or not. So the safest option would be, yes, your boys would have to be quarantined for 14 days, and then they would have to come directly to the country house and then not leave the country house. We've mentioned it before, setting up the safety perimeter around your house, and that would be the same thing for the country house and for everyone there. Yeah.
I have one over here. Popular one keeps coming back. What do you know about chloroquine? Big results in the USA with hydroxychloroquine and Z-Pak. Z-Pak is the azithromycin antibiotic against bacteria. People with the virus have been cleared from the ICU 4 days after using the medication. Hence the question, does Quebec have these meds available if one would need them as an option? So let's tackle this again because it's popular. For those of you who have been following, I think we already answered this in our second video. So let's start like this. Chloroquine is an old anti-malarial drug, kind of fallen out of favor from the malaria point of view because of many side effects, serious side effects. And hydroxychloroquine, which is its brother, otherwise known as Plaquenil, is still used for many patients who have serious autoimmune diseases. It might be rheumatoid arthritis, maybe some other autoimmune. Now, the first point I would make is all of this started with a small study out of France. Now, of course, everyone is desperately looking for a solution. And if we can repurpose some old medications that we have, maybe with some antiviral, antibacterial activity, maybe we could save a lot of time and a lot of lives. And so it's not that they were bad studies. They did the best they can with the time they could in a desperate situation. Having said that, the studies were not really quite rigorous, and there's a lot of potential errors that could happen if we just take them at face value. So I would say at the moment, given all the expert opinion and some of the newer studies that have been done, there's really no evidence for hydroxychloroquine or chloroquine actually having any benefit. On the contrary, and this is how medicine and science evolves, we're seeing a lot of the toxicities. There are some serious toxicities, why we're not using it as much anymore, particularly cardiac toxicities. You really need to be careful. And at this moment, I would say the risks outweigh the benefits. There's one final thought I had on this though, and that's that the people that really need the medications, the people that need it for rheumatoid arthritis or autoimmune, there's now a severe shortage, like pandemic, when people are panicking for masks and stockpiling things, and these are life-saving medications for them. So now we're running into that problem for the people that really need the drugs.
Yeah, so let's try to save it for them because we know it helps them.
Yes.
So that's all the questions that we have for today. We're wishing everyone best of health and stay safe.